Hi everyone. So in this video, we're going to talk about cognitive therapies, and it's pages 561 to 566. So cognitive therapies, it's a group of psychotherapies, and it's based on the belief that psychological problems are caused by illogical thought patterns, and the techniques focus on recognizing and changing those unhealthy thinking patterns. Most people blame their unhappiness and problems on external events and situations. But the real cause of unhappiness is in the way a person thinks about the events and not necessarily in the events themselves. Cognitive therapists will zero in on the faulty irrational patterns of thought that they believe are causing the psychological problems. So Albert Ellis, he was a practicing psychoanalyst, and he's expressed, "You largely feel the way you think." So as a psychoanalyst, he became increasingly disappointed with the psychoanalytic approach to solving human problems. He realized that psychoanalysis simply didn't seem to be working. He would see his patients have insight after insight after insight, but never actually get any better. So in the 1950s, Ellis began to take a more active and directive role in his therapy sessions. He developed Rational-Emotive therapy, which we now call Rational-Emotive Behavior Therapy, which is abbreviated RET. So Rational-Emotive Behavior Therapy is a type of cognitive therapy developed by Ellis that focuses on changing the client's irrational beliefs. Most people mistakenly believe that they become upset and unhappy because of external events, but it's not the external events that make people miserable. It's their interpretation of those events. So in looking at the steps of Rational-Emotive Behavior Therapy, the first step is to identify the core irrational beliefs that underlie personal distress. The irrational beliefs reflect all those musts and should that are absolutes. For example, I should be competent in everything that I do. The consequences of such thinking are unhealthy, and they can cause unhealthy emotions and unhealthy responses that interfere with constructive attempts to change disturbing situations. So in your book in table 14.4, you saw the following irrational beliefs. It is a dire necessity for you to be loved or approved by virtually everyone in your community. You must be thoroughly competent, adequate, and achieving in all possible respects if you are to consider yourself worthwhile. Certain people are bad, wicked, or villainous, and they should be severely blamed or punished for their villainy. You should become extremely upset over other people's wrongdoings. It is easier to avoid than to face difficulties and responsibilities. Avoiding difficulties whenever possible is more likely to lead to happiness than actually facing difficulties. You need to rely on someone stronger than yourself. Your past history is an all-important determinant of your present behavior. Because something once strongly affected your life, it should indefinitely have a similar effect. So those are the irrational beliefs that your book identified. Now the next step in REBT is for the therapist to vigorously dispute the irrational beliefs. The therapist tends to be very direct and even confrontational in this. Now they're not looking to start a fight, but they're trying to convince this person, look, what you're believing isn't true. So they have to make sure that they take that stand. They can't be like the humanistic approach might say, are you sure that's really true? Maybe it's not. What do you think? And in this, they're actually very confrontational. What you're believing isn't true. It's not true that everybody has to like you. They will be very confrontational about that and very direct. Now, the long-term goal is for the clients to actually recognize and dispute their own irrational beliefs in a wide range of situations. Now, it's important to know that responding rationally to unpleasant situations does not mean denying feelings. Ellis believed that it's perfectly appropriate and rational to feel sad when you're rejected or regretful when you make a mistake. Appropriate emotions are the consequence of rational beliefs. For example, a person feeling upset because not everyone likes them and saying, I would prefer that everyone likes me, but that's not likely to happen, because then they're being realistic about what's happening, but they're not denying their emotions about it either. Now, REBT is a very popular approach in clinical practice. It's straightforward, it's simple, and it has been shown to be generally effective in the treatment of major depressive disorder, social anxiety disorder, and some other anxiety disorders. It's also been successful in treating self-defeating behaviors such as an excessive need for approval, extreme shyness, and chronic procrastination. Personally, I have used this in patients with eating disorders and with those with severe perfectionism issues. So now we're going to talk about Aaron Beck and cognitive therapy. So Aaron Beck, just like Ellis, he was initially trained as a psychoanalyst, and he's responsible for developing cognitive therapy. So cognitive therapy, abbreviated CT, is a therapy that focuses on changing the client's unrealistic and maladaptive beliefs. Cognitive therapy actually grew out of Beck's research on depression. He was looking to scientifically validate the psychoanalytic assumption that depressed patients have a need to suffer. So he started collecting data on the free associations and the dreams of his depressed patients. He saw that depressed people have an extremely negative view of the past, the present, and the future. Rather than realistically evaluating their situation, depressed patients developed a negative cognitive bias, consistently distorting their experiences in a negative way. They would find the negative in even positive things that were happening. And these negative perceptions of events and situations are shaped by deep-seated, self-deprecating beliefs such as, I can't do anything right, I'm worthless, or I'm unlovable. So cognitive therapy focuses on correcting those cognitive biases that underlie major depressive disorder and other psychological disorders. Now, just like Ellis, Beck believed that what people think creates their moods and emotions. And like REBT, CT involves helping the clients identify faulty thinking and replace unhealthy patterns of thought with healthier ones. In contrast to Ellis's emphasis on irrational thinking, Beck believes that major depressive disorder and other psychological problems are caused by distorted thinking and unrealistic beliefs. Rather than logically debating the irrationality of a client's beliefs, a cognitive therapist encourages the client to empirically test the accuracy of his or her assumptions and beliefs. So let's take a look at how that occurs in Beck's cognitive therapy. So the first step is to help the client learn to recognize and monitor the automatic thoughts that occur without conscious effort or control. Depressed people usually have automatic thoughts that reflect very negative assumptions of experiences. In the second step, the therapist helps the client learn how to empirically test the reality of those automatic thoughts that are so upsetting. For example, to test the belief that, quote, I always say the wrong thing, end quote. The therapist might assign the person the task of initiating a conversation with 3 acquaintances, and then noting how often he or she actually said the wrong thing. Next step, initially, the therapist typically models the techniques for evaluating the accuracy of automatic thoughts, hoping to eventually teach the client how to do the same thing on his or her own. The therapist also strives to create a therapeutic climate of collaboration and encourages the client to contribute to the evaluation of logic and accuracy of those automatic thoughts. This is in contrast with the confrontational approach used by REBT. The REBT therapist directly challenged the client's thoughts and beliefs. Cognitive therapy has been shown to be effective in treating major depressive disorder and other psychological disorders, including anxiety disorders, borderline personality disorder, eating disorders, post-traumatic stress disorder, and relationship problems. Along with effectively treating major depressive disorder, cognitive therapy could also prevent it from recurring, especially if clients learn and use the skills that they actually learn in therapy. So cognitive behavioral therapy. Cognitive and behavioral techniques are often combined in therapy. And cognitive behavioral therapy, CBT, refers to a group of psychotherapies that incorporate techniques from both approaches. CBT is based on the assumption that cognitions, behaviors, and emotions are all interrelated. Along with challenging maladaptive beliefs and substituting more adaptive conditions, the therapist uses behavior modification, shaping, reinforcement, and modeling in order to teach problem-solving skills and change those unhealthy behaviors. This is really a pragmatic approach. Therapists design an integrated treatment plan combining techniques from behavioral and cognitive approaches that are most appropriate for specific problems. CBT has been used in the treatment of children, adolescents, and the elderly. Most of these are primarily just for adults, but CBT can be used in all age ranges. CBT has been found to be a very effective treatment for many disorders, including major depressive disorder, eating disorders, substance use disorder, and anxiety disorders. Of note, it is also commonly used by the military for treating patients with PTSD. So CBT can also help decrease the incidence of positive symptoms such as delusions and hallucinations in patients with schizophrenia and psychotic symptoms by teaching them how to test the reality of their mistaken beliefs or perceptions. CBT also offers flexibility because it can be adapted for use in different cultures. In studies, they've determined that CBT treatment provided via the internet appears to have similar outcomes to when the therapist provides the therapy in person and face-to-face. So CBT can also be used to prevent the onset of mental illness in people determined to be at risk. So now we're going to talk about the mindfulness-based therapies. An emerging approach in cognitive behavioral therapy involves the use of mindfulness techniques. And these new therapies are actually called mindfulness-based interventions, or sometimes mindfulness-based therapies, or sometimes mindfulness and acceptance therapies. Unlike cognitive behavioral therapy, however, mindfulness-based therapies don't seek to challenge the content of the thoughts. The goal is to change the context in which those thoughts are understood. Clients are taught to observe and change their relationship to maladaptive thoughts and emotions. The ability to monitor thoughts and feelings without judgment ideally allows people to experience disturbing thoughts and feelings without reacting to them. One important technique is called decentering. Individuals are taught to notice, label, and relate their thoughts and emotions as just passing events, rather than to identify with them or allow them to shape their experiences. By increasing mindful awareness of thoughts, impulses, cravings, or emotions, clients are less likely to act on them or be ruled by them. One of these therapies is called acceptance and commitment therapy. I've got some information about it within your course. This is what we used primarily with our eating disorder patients. And we used to actually tell them if they had a thought that was a thought they would have deemed negative, like, I'm so fat, or something like that, to imagine it floating away in a balloon, or to say it in a sing-song voice, or something of that nature to kind of make it silly so they wouldn't listen to it. All right, mindfulness-based stress reduction was the first mindfulness-based therapy to actually earn broad acceptance, and it uses mindfulness meditation, yoga, mindful body practices, and group discussion. So this has actually been successfully used to treat stress and anxiety, and it's also been used as part of cognitive behavioral treatments, for example, for people with substance use disorders or borderline personality disorder.